Hello everyone. InformationBoxTicket Lifestyles brings you microbiology lecture on tetanus. But before watching, don't forget to like this video, subscribe to my channel and press the bell icon button so you don't miss any of my videos. Let's begin. As you know, microbes, also known as microorganisms, are everywhere, on surfaces we touch, in the air we breathe, and even inside us. As suggested by the name, all microbes are too small to be seen without a microscope. Beyond size, microbes are incredibly diverse. Microbes include bacteria, fungi, and protists. Today we are talking about a disease which is caused by microorganisms, which is tetanus. Clostridium tetani is a causative organism for the disease process known as tetanus. Clostridia are anaerobic organisms with at least 209 species and 5 subspecies. Clostridium tetani is one of the 4 most well-known exotoxin-producing pathogens within this category. Clostridium tetani is a part of a genus of obligate anaerobic, saprophytic, gram-positive bacilli organisms, well known for its toxin-producing ability, making it one of the most dangerous of its genus. It is a spore-forming organism that cannot be eliminated from the environment and can withstand extreme temperature conditions in both indoor and outdoor environments. It is well known that tetanus spores can survive in the environment for many years and are often resistant to heat and disinfectants. As Clostridium tetani bacteria mature, they develop terminal spores and widely distributed in cells and enter their host through a wound in the skin, where they replicate and produce toxins. Thus, it is important to recognize the typical clinical presentation, immediate management, and treatment of Clostridium tetani infection. Today we will learn about its pathogenesis, signs and symptoms, prevention and treatment, and its complications. Let's understand its pathogenesis. Its spores are extremely resilient and resistant to heat, and it produces a tetanospasm, an exotoxin which has neurotoxic activity, which acts at the presynaptic membrane of inhibitors motor nerve endings of Rensor cells in the spinal cord. Tetanospasm is a protease that cleaves nerve proteins synaptobrevin 2, due to which there is a loss of inhibitory signals to alpha motor neurons, which blocks the release of inhibitory neurotransmitters glycine and GABA. Therefore, excitatory neurons act unopposed, which leads to rigidity, unopposed muscle contractions, and spasms. Tetanus is characterized by severe diffuse muscle contractions. The muscular rigidity and spasms of tetanus are caused by tetanus toxin, tetanospasm. The transmission of Clostridium tetani is through the exposure of a deep tissue wound to the spores which are present in soil or fecal matter from animals or humans. Given that Clostridium tetani is an obligate anaerobe, the anaerobic tissue wound provides an ideal environment for the replication and growth of Clostridium tetani. Following extensive bacterial replication at the wound site, an expression of genes encoding the two toxins, tetanospasm and tetanolysin, occur. Tetanospasm is taken up at the nerve terminals of the peripheral nervous system and can interfere with the vascular release of acetylcholine at the neuron-muscular junction. Thus, an initial presenting symptoms of tetanus is flaccid paralysis, which can resemble the effects of Clostridium botulinum. However, the toxin is transported in the retrograde fashion towards the central nervous system and eventually reaching the spinal cord or brain stem. It is here that tetanus toxins produces its characteristic satellite of symptoms. The toxin causes inhibition of the release of GABA and glycine inside inhibitory nerves terminal that control the activity of lower motor neurons. Thus, this action causes a hyperactivity effect leading to involuntary contraction of skeletal muscles. Kindly don't forget to like this video, subscribe to my channel and press the bell icon button. Now let's see its signs and symptoms. The first symptom is tetanus. Locked jaw commonly arises as one of the first signs of tetanus. The next is tetanus, state of pronounced hyperextension caused by severe back, muscle spasms characterized by arching of the head, neck and spinal column. The next is rictus sardonicus, sardine smile, appearance of raised eyebrows and open grin caused by an abnormal sustained spasm of the facial muscles. Several other symptoms are difficulty in swallowing, fever, irregular urination and defecation, excessive sweating, drooling, and breathing problems. It only affects skeletal muscles and it is a sympathetic overactivity. Kindly don't forget to support my channel by subscribing to it. Next is prevention and treatment. Prevention is caused by vaccine against diphtheria, tetanus, and pertussis. Mainly treatment is conservative wound debridement, indication patients with contaminated or dirty wounds. Medical, tetanus antitoxins, antibiotics, diaspasm for muscle spasms, and vaccine boosters. The focus of acute tetanus management should center around toxins, medication, and aggressive symptom management, including airway protection. All patients with tetanus-prone wounds should undergo immediate cleansing and debridement to eradicate spores and avoid further spread of the toxins from the tissue to the bloodstream. Patients with signs and symptoms of tetanus should be admitted to intensive care unit for initial managements. Some patients may even require mechanical ventilation. Symptom management is the utmost importance. Complication of tetanus is tetanistic paralysis. Respiratory comprise from spasm of respiratory muscles, aspiration pneumonia, and contracture. Tetanus toxins bind irreversibly to the tissue, so the focus of neutralization is the unbound toxins. Human tetanus immune globulin should be given as soon as tetanus is suspected at a dose of 500 units. Antimicrobial therapy for the wound is typically given for 7 to 10 days. It is important to note that antimicrobial therapy plays a relatively minor role in the management of tetanus. Muscular spasms in the setting of tetanus are life-threatening and can lead to respiratory compromise, aspiration, and exhaustion. Benzodiazepines can be used to controlling the rigidity and spasm associated with tetanus. Situations where sedation is not sufficient, neuromuscular blocking agents such as pancuronium or vancomycin can be used. Infection with Clostridium tetani does not provide immunity, and thus all patients with the diagnosis of tetanus should receive immunization as soon as possible with tetanus toxoid. And that's it for today. Take care of yourself. Don't take your health for granted. Don't take your body for granted. Do something today that communicates to your body that you desire to care for it. Tomorrow is not promised. Don't forget to like this video, subscribe to my channel and press the bell icon button so you don't miss any of my upcoming lectures. Thank you.